All right, Zoom is starting the meeting, setting up your meeting for Facebook Live.
All right, ready to roll?
Yep.
All right, hello everybody. This is the second of the Salaam Clinic Live podcast. I'd like to welcome everybody. If you haven't had a chance to check out the last one, please check it out. It's on our Facebook page. Soon it'll be in other platforms, our YouTube page as well. You can check it out at facebook.com/Salaam Cleveland. And also while you're there, take the time to subscribe and to our newsletter, see what's going on, what's happening around our world here in Northeast Ohio and in the nonprofit world as well. Today we have a really special guest with us. Her name is Dr. Erum Ahmad. She is a child and adolescent psychiatrist here in Cleveland, Ohio. She completed her training in general adult, child and adolescent, and consultation liaison psychiatry. She's also involved in several local professional organizations, and she also teaches medical students and residents and fellows in psychiatry. She's also the director of an inpatient unit here in Northeast Ohio for child and adolescent psychiatry. So welcome, Dr. Erum Ahmad. How are you doing today?
Good. Thank you so much, Azam and Shoaib, for having me here. I'm excited to be here and to talk about this important subject.
Oh, of course. And for those who are tuning in, the subject today is mental health in children, especially during this pandemic. Right as of now, we're still going through the pandemic. The COVID-19 is still around. Schools are around that time where they're going to start opening back up, whether in person or online. And, with that comes a lot of other things and a lot of other issues related to our children's well-being, our family's well-being, et cetera. So how big of a problem, generally speaking, how big is a problem with mental health and children and adolescents?
So, I think you have to think about what was happening before the pandemic and what was happening after the pandemic. And what we know is in the last couple of years, mental health has become increasingly important in children and adolescents. And we used to think of this being a problem only in adulthood, but we know that that's not the case. And in fact, rates of just general depression, anxiety, behavior problems, those are all increasing, and we know that the rates of suicide have increased. And in fact, the age group that has one of the highest rates of suicide currently is the age range that the children and adolescents generally fall into. So it's definitely.
Now, really quick, if you don't mind. Now, I'm just going to backtrack just a little bit. Now, you said over the last few years, it's kind of been an increasing thing. Now, is it that mental health has become sort of like a catchphrase and it's kind of like the fad right now, or is it the need or the sort of like the disease is actually increasing in our population, or has it just not been noticed as much before the pandemic?
Right. So those are good questions. I think it's a little bit of everything. I think that the rates of illness have definitely increased because there's more cases. I feel also that people are starting to become more comfortable talking about it, which obviously then leads to higher rates of recognition. It's definitely, things like anxiety and depression are very common over the lifespan. And also when you have people like Kevin Love or other celebrities who are bringing it to the attention of the forefront and talking about it more freely, you're going to have people feeling more comfortable to share what they're experiencing and then lead to higher rates of recognition. And these are all positive things, right? We want people to share, we want people to feel comfortable to express their concerns, to seek help. I think also, a lot of things have led to maybe increase in distress in children and adolescents. So things like bullying have become more prevalent. From like a personal, reflection, I feel like bullying has become is more prevalent than it was when I was growing up. And that's a big thing. Trauma, we're starting to recognize effects of trauma now. A lot of people have been exposed to some form of trauma. It might not be physical trauma, and that might not be sexual trauma, it could be emotional trauma or neglect. And so that's all compounding what we're seeing, and that's all heightening the effects of distress in children and adults.
You make a good point about the bullying. Like when I was growing up, bullying existed, it happened. Right. But now you also have in the mix, it seems to be more awareness amongst school children that, hey, bullying can lead to some pretty negative things. Whereas, and unfortunately, there's an opinion amongst older individuals that, hey, everybody gets bullied. It's a normal thing. So have you ever come across that? Like, how do you deal with that sort of thing? Maybe there's a child who has parents like that where, oh, just getting bullied, it's not a big thing. Yeah.
Well, that's a very interesting question, Shoaib. I think there's multiple parts to it. So one thing that I think makes the bullying now different than when we were growing up is the effects of social media, right?
Yeah.
So nothing is hidden anymore. Everything is out there. Everything is permanent. When we were growing up, only a few people knew about things, right? And until cell phones and until the internet and Facebook.
Facebook didn't come out until what? I was in college.
Yeah. Exactly. Yeah. And so now it's like, the internet doesn't hide things. The internet, everything is memorialized in the internet. And so,
and that's a good because now I feel like, hey, when the home used to be a safe place, right? You go there, you're disconnected from everything. It's you, it's your family, and you're just chilling, right? Now everybody's had their phones, their social media. It's like, hey, you could be in the privacy of your home, but still be exposed to the world at the same time. And does that have negative effects on children?
Sure. I mean, we think that there are some positive aspects of social media and technology, but everything comes in balance. Everything needs to be in moderation, and there's definitely some negative aspects. Sometimes you worry that they're getting the wrong type of socialization and they're missing that personal, one-on-one, face-to-face, or over the phone, or whatever. It becomes an artificial type of communication. It can lead to reinforcement of social anxiety, avoidance of social situations, right? How do we challenge ourselves? We expose ourselves to what it is that makes us nervous. That's what leads to the greatest growth and development, and that's what leads to overall overcoming things like anxiety. But sometimes using the phone and social media can prevent us from doing that, and it can become challenging.
Yeah, and especially with social media, because I feel like it's not the face that children put forward on social media. It's not really them as children, right? It's more aspects of their life that they're showing to people, and it creates this sort of almost expectations or something that, hey, I need to have this or I need to have that.
Absolutely. And that's one thing that children, we know that our brains don't finish developing until sometime in our mid-20s, right? When you look at gender differences, I think females develop at a quicker rate than males, but that's neither here nor there. But children, for that reason, can't really see that it's not always going to be like that, and that it's very short-sighted and very, so much about the short game as opposed to the long game. And I definitely think that the bullying has heightened the immediate, we're used to having like immediate gratification now as opposed to waiting for things. I think that the content of the bullying has also changed, right? Which leads to more social isolation, which then can contribute to depression and anxiety.
Oh, okay. So before we jump into sort of the pandemic right now, for those who are just tuning in, we're still kind of like in the pre-pandemic, just general children's mental health and the way things were going. And now we brought up, a really interesting aspect is that, hey, learning and growing in it, and being at home, being on your social media. So these social media things in the developing brain, I think that's a really interesting topic. Let's just kind of dive into it really quickly. So obviously, like you said, the brain doesn't finish developing until you're about 25 or so, right? In mid-20s or something. can these sorts of things stunt growth or stunt, your brain from growing the way or maturing the way it's supposed to be?
Sure. I mean, I don't know the exact mechanism by which it does. I know that the American Academy of Pediatrics has, pretty robust guidelines in terms of how much TV, how much social media things, phone time that kids should be having, especially in those early years.
Yeah.
But when we think about what it takes away from the individual in terms of real communication and real conversation and face-to-face and solving problems in real time in face-to-face, it absolutely can affect one's future skills and one's future abilities.
So future skills, future abilities in terms of anxiety, right? Or depression, which a lot of these kids are going through, and their social activities already been sort of altered by this new dimension of social media, etc. Now they're not going to school. Now they're at home, right? Now it's COVID-19, pandemic comes in. What can we realistically expect from children to be able to understand understand the pandemic and the stress that comes with that? I read somewhere that 41% of adults have noticed some sort of mental, I don't want to say illness, but necessarily like increased stressors during the pandemic. And so I'm sure that's translating to the children as well. Is it? Do you see it?
Absolutely. I think, I think in the beginning, what we saw was kids being excited about school, like closing early, but not necessarily realizing what that would mean. I think every child is different. So I've seen kids who are doing just fine, but I've also seen kids that have really struggled. And I think the longer we have this new normal, the more we're going to start to see that. And we were talking about for kids, and especially as they become, adolescents and they're starting to move away from their family being the center of their universe and moving towards socializing with their peers and finding jobs or, spending time with friends outside of the home, you're going to definitely start to see more distress and more social isolation and just, an inability to get away from whatever it is that might be stressful at home for them. Because obviously being in such close quarters, it doesn't necessarily make things better. It can bring about more tension, and everyone needs their space. So we're definitely seeing more anxiety and depression in kids.
And how does that kind of come through in children? So say I'm a parent, I have a child, or maybe even an adolescent. How do we know it's something more than the typical adolescent behavior, that, hey, maybe there's something more going on with them that I need to kind of pay attention to? What are some warning signs?
So definitely, if you find that your child is becoming more irritable for longer periods of time than what they typically are, where they're starting to withdraw from other things that used to bring them joy, used to make them happy, withdraw from the family, if that was something that they were previously doing a lot of. Other things to look out for would be that they're not attending to like their grooming or their hygiene. They've stopped eating. And then the more serious things to definitely look out for would be if they're starting to engage in self-harming behaviors, or starting to talk about not wanting to live anymore, starting to talk about suicide, starting to perhaps even engage in substance use.
And since the pandemic sort of started, have you seen an increase in that sort of behavior, or an increase in those stressors and those types of things in your units or in your outpatient?
I think my colleagues and I and many others in the city probably have definitely seen an increase. In the beginning, it sort of varied. There was a lot of, I think initially people were afraid to come to the hospital, but now we're starting to see a lot more substance use, a lot more self-harming behaviors, a lot more inability to soothe and calm oneself, and like higher frustration tolerance.
Yeah. So what are some
or lower frustration tolerance, sorry.
Okay. So what are some things we can kind of do for our children or even for ourselves, you know, during this time where we are kind of socially isolated, maybe a lot of there's these negative behaviors that kind of pop up, more negative coping mechanisms, I should say. What are some more positive coping mechanisms we could do with our children together, or maybe not together if they don't, you know?
Well, one of the first things I always tell to caregivers and families is that you can't pour out of an empty cup, right? So it's so important for the caregiver to be in good health, physical health, mental health. You know, I always also say, like, when you're flying on an airplane, you know, when they say, like, in the event of an emergency, take care of yourself before taking care of others, it's absolutely true. So whatever that means to the caregiver, whether that means taking some time out for self-care, you know, taking some time out for some socially distanced and safe socialization. So I always start with the caregiver. The other thing, you know, in terms of kids, every child is different. So recognizing the individual needs of your child might need to spend some time, you know, doing their own thing and having some time to themselves to reflect. Whereas others might need more time for some socialization, and whether that means doing more Zoom sessions with their friends or doing something, you know, fortunately the weather has been so pleasant, and it's really easy to do outdoor socially distanced activities while wearing masks or, you know, from a distance. And that's something, again, that's something that families have to decide for themselves in terms of, you know, what is appropriate for them. Having regular conversations or check-ins, you know, hi, how are you doing? I want to see how, you know, I just want to check in. How are you feeling? Just creating an environment where children feel comfortable to express themselves.
Environment, that's a good sort of thing, because, you know, and we're speaking in like a utopia where children, their homes are perfect, you know, their parents get along, their siblings get along, and but unfortunately, you know, the reality is that's not the case for a lot of us, right? Our home might not be the best place, or it might be detrimental almost, right? And is that something you see in that sort of patient population with, I hate saying that when I talk about kids, but in those kids that have those illnesses and anxiety, depression, and come in, you know, maybe self-harming themselves, how big of a role is that sort of family life, or that, you know, at-home life?
It's so important. Children are a product of their environment. And what we're seeing too is that, unfortunately, when the schools closed, you know, there was a lot that came out about higher rates of abuse, higher rates of neglect, higher rates of violence. That just because school was where all of this was being reported and noticed. And school teachers, you know, school psychologists, therapists, guidance counselors, they were the ones doing the reporting. And I believe I was reading an article within the last month or two about the rate of child abuse reports that went down in that period of the pandemic compared to prior years. And it wasn't because we know that the rates didn't actually go down. It was just that the reports weren't being made because people weren't in school. And that's where a significant portion of the reports being made to Child and Family Services are coming.
And that's such a good point that, you know, I didn't even think about that, yeah, a lot of it's reported at school, and now schools aren't able, you know, they aren't at school. So
or they weren't seeing them, right? They weren't talking to them necessarily. And even now, now with the virtual schooling, that you still can't get the whole picture. You can't get the whole feel. School was a place where people were getting food, right? Fortunately, there were a lot of places in the city that, you know, came together and put food out there for people that needed it. But we forget how much of how many important things school provides to so many children in this community. Yeah,
the support at school must just be like, you know, it's crazy for them. Like they really need that. We do have a third person on this podcast. His name is Azam Kazmi. He helps produce this. So Azam, do you want to jump in? I know you have a question.
Yeah, so, yeah, I think we were talking earlier, and I told you
Mhm.
I have some kids myself, so I'm going through this whole situation personally. I did have one question for you. Like, do you see any connections with bad dreams and mental health, or that's separate? And the other question I have for you is, uh, how do you approach kids to kind of have that talk? Is there a certain style of going about it, or just kind of different kids, different things, different families? I don't know if you
Sure.
got anything.
No, those are great questions. And when you say the talk, do you mean like talking about mental health and what it means to like be anxious and things like that?
Just try to, get in their brain and try to see
Yeah.
if there's anything bothering them.
Yeah.
I think the kids, my personal opinion is when the kids stop listening to you, then there's something else going on.
Mhm.
And just trying to figure that out.
Sure. So dreams, absolutely, young kids are very, their anxieties and their stresses can manifest in different ways. They can manifest with physical symptoms. So it's not uncommon for a young child who's anxious about going to school to wake up in the morning and say, "Mommy, my tummy hurts," or "Mommy, my head hurts." How many times did we say that, right? Growing up, trying to get out of school. But other things can be nightmares and weird dreams. And if it's something that's a recurring issue, it's definitely something that you want to look into more and talk more about. I think, again, it depends on the developmental level of the child. So, your communication with a 5-year-old might be very different than your communication with your 16-year-old. And I think, it's important to create the environment and the culture that this is something that we absolutely want to pay attention to and that we want to talk about. And I do think that there's been a significant shift in our community over the past decade or so. Growing up, I know that mental health wasn't something that was really widely shared in the community. If anything, it was like an afterthought and it was something kind of scary. But in recent years, I think there's definitely been some attempts made at doing that. I think you just have to have the ongoing dialogue. You have to have people that are willing to say that mental health is just as important as your physical health.
Mm.
Well, I mean, I would even go on to say that mental health might be more important than physical health.
Yeah, and we know that the mind and the body are very much connected. So one thing I talk to kids when I'm seeing them and their anxiety or their depression is manifesting in physical symptoms is that your mind and body are very much connected. And in order to take care of one, you have to take care of the other.
Now, I just want to backtrack to the trauma. I know we were talking about trauma a lot. How does that stress or how does that trauma sort of manifest differently between, say, somebody who is a 5-year-old or a 6-year-old and somebody who's 16 or 17? Now I can assume I can be like, okay, there might be drastic behavior changes in the 16 or 17-year-old.
Sure.
But how about like a 5 or a 6-year-old? How do you know? If I recall my back when I was in med school and I was going through my psychiatry rotation, there was the concept of like they mature quicker. Their brains end up maturing quicker, but then stop maturing at a certain point. So in adulthood, they're very childlike, but while they're young, maybe 8 or 9, they're talking like they're in their teens. Is that something? Is there truth behind that, or is it just something?
It can happen. It can happen for sure. I think overall trauma can be very detrimental if it's not something that one receives good treatment for, right? So trauma-focused therapy can be very helpful and can help one to learn to regulate their emotions and their feelings and work through the trauma. I've seen 5 or 6-year-olds with trauma history that remind me of, maybe 12 or 13-year-olds. And then I've also seen patients who are much older that remind me of people who are much younger. And so you're right. I mean, I think, it's not one size fits all. I think it depends on what other factors are in their environment, what other supports they have. young children with trauma can manifest with really physical symptoms. And that could be like weird dreams, that could be bedwetting, that could be, physical, like headaches, stomach aches. Older kids might start to have more memories of it. They might start to have more flashbacks or nightmares. They might also start to act out or become very irritable, might engage in unruly behaviors, things like running away from home, things like, engaging in what we would not consider to be pro-social behaviors, so using substances or sexual promiscuity. Again, trauma can affect different people in different ways. But it's always important, I think, to keep trauma in the back of your mind when you're thinking about people, because trauma is everywhere, is what I've started to realize.
And I just want to have I try to keep everything a little lighthearted, but these are very deep and heavy subjects, but they're important to talk about. And one thing you mentioned earlier was therapy. And I know growing up, just truth be told, we used to look at therapy like, oh, weirdos get therapy, right? Or like people that, there was that sort of stigma behind something like therapy. And now I feel like the tide is turning, but I know from people in the community here locally in Northeast Ohio, it's not there quite yet. Like the thought of having to send their kid to therapy, something you should hide or something, something like that. Not saying that his medical history should be out in the open, but is the impacts of therapy and the positive outcomes from that. Can you just speak to that a little bit?
Absolutely. So, there's evidence that therapy leads to the most long-term gains in terms of overall functioning. We know that for really severe depression and anxiety, while medications are helpful, therapy is also really important to maintain improvement of the symptoms and also to help decrease suicidality and suicidal thoughts. Therapy, I view therapy as it's sort of like analogous to physical therapy, right? So you do, when you have an injury, when you have a muscle injury or something, you do physical therapy to bring your functioning and your strength and rebuild the muscle. It's the same thing. Your brain is just like a muscle. I mean, it's going to learn new things. It's going to take in new coping skills, new ways of thinking, and that all comes from therapy. And so oh, go ahead.
I'm sorry, go on. No, go on. I don't mean to cut you off on therapy.
So I say that so there's something that a friend, a colleague, a former, a psychiatrist who's also known in our community once said, is that therapy is a luxury for some people, necessary for others, but helpful for everyone. And I always say to people, I think everyone falls into that last category.
Wow, yeah. I like that saying. Therapy is a luxury for some. What was that other, the second part of that?
Necessary or essential for others, but
essential for others, but helpful for everybody.
Yeah.
All right, that's something good for everybody to know, me and myself included. We do have a question coming in. Sometimes in our community, parents use corporal punishment. Can you address this? I think that means physical punishment. Right.
So as a child psychiatrist, I don't condone physical punishment. I know that there's always been culturally different styles of disciplining, and it's also generational. So certainly I've worked with families who it's sort of the norm. As a medical professional, though, it's my duty, as a physician, if I am concerned about someone's physical safety, I have to make that report. But going beyond that, physical punishment, really, the evidence does not suggest any benefit to it. In fact, it can make things worse. It can lead to worsening of the behaviors. It can lead to mistrust of the caregivers. It can lead to trauma symptoms. It can lead to an inability to regulate emotions. So it's definitely not something that has any short-term or long-term benefit.
Well, I'm gonna throw a question at you, and let me know if you could answer this or not. When does corporal punishment or physical sort of punishment become abuse? or is it one and the same, or something else?
Yeah. So that's a really complicated question, Shoaib.
Yeah.
So I think as a professional, anytime I'm concerned about someone's safety or a child is telling me that they don't feel safe at home, I make that report.
Yeah.
And obviously the county then, sometimes the state then decides whether or not that's abuse or really truly unsafe living situations. But that is, that's a very complicated question. And I think
I don't mean to put you on the spot.
No, that's a good one. Certainly, like I said, we want to be cognizant of people's cultural background. But if I have a situation where I feel like someone is in direct and risk of harm, like that there's a direct safety risk and an imminent safety risk, that's something to me that escalates that level of concern.
Yeah. And for those listening out there, one of the things that during physicals that we kind of look for, or that if we notice we should really take severe note of, is different, like bruises of different ages, right? Like seeing different marks and welts and things like that. And
right.
Oh man, it's getting really deep, and talking about those things.
But it's important to talk about because it happens, and it's not something we can talk about what happens like outside of the United States, but here in the United States, and we know that the long-term studies don't support the use of corporal punishment at all.
Yeah. And it's really good, because it's one thing to argue cultures. It brings about this whole other aspect, but when you have evidence behind something or facts behind something, it's very tough to argue against that, right? So it just goes into the whole importance of having research and medical research and outcomes and all this and all that, which makes the job that you do as a child and adolescent psychiatrist even more like noble of a job, because you're dealing with some of the deepest stuff, right, on a daily basis. How do you kind of, I'm sure you have horror stories, right? I'm not asking you to share them at all,
no.
But so what do you kind of do to cope with that, to keep your own health?
Oh, that's a really good one. And I have to say that's something I've been thinking more about recently, because I think things have definitely picked up as a result of the pandemic. And, the pandemic has changed things for everyone, me included. And so finding, moments of happiness or things I'm grateful for. So studies have shown that expressing gratitude and paying attention to gratitude have also helped in building resilience. And so, just some examples of things.
I'm sorry, really quickly, just for those listening out there, can you kind of explain what resilience is?
Yeah, so resilience means the ability to sort of be strong in the face of adversity, and the ability to sort of push through and to make it right when things are tough. And resilience is important for treatment of depression and anxiety and trauma. And those who have greater resilience have better outcomes. And so, things that I do are trying to, pay attention to gratitude and being intentional about gratitude. Doing mindfulness and meditation. I've started to do more of that recently. Also trying to pay more attention to my physical health. So going to exercise in the morning, even though like waking up at 4:30 is not what I want to be doing. But you're absolutely right. As caregivers, as people who are in the community and, paying attention to the news, whether it's the pandemic or the social injustice that's around going on in this country, it's starting to take a toll on everyone, and finding ways to combat that, whether it's micro moments during the day, it doesn't have to be extensive periods, but those are all really important.
So it's like give yourself some time. Like, yeah. I'm a big believer in that. Was that awesome?
would you agree that walking is one of the best exercises for clearing your mind and mental health? Something that I think everyone should know. What is a good exercise?
Like physical exercise, I think it's whatever, to me, it's whatever exercise that you are going to be able to continue to do. So if yoga is not your thing and you're not going to be able to continue to do it, don't do it. For me personally, I need to be doing, I like walking, but I need to be doing something more like faster and more like I'm moving faster than I'm thinking, essentially. So for me, the elliptical is my thing. But on the days that I can't do the elliptical, I go walking, or I try yoga. But again, it's whatever brings you joy and whatever is easy and whatever you're going to be able to continue to do.
Yeah. I was just imagining myself trying to do yoga. And
right? It's hard.
But
it takes practice. And so that's what I always say about therapy too, is it's not going to be fixed in one session. And it's not going to come together in a couple of sessions. It's practice, right? It's working your brain, it's working your mind.
Yeah. I'm gonna jump to some of the questions we got coming in again. There's a follow-up to sort of the corporal punishment question. It's have you found an effective way to discourage parents to use physical punishment, corporal punishment as a parenting technique?
Well, what I try to do is I try to be sort of like, I try not to jump directly to say don't do it, right? Because we know that that's not going to work. I try to find out more about the circumstances that make them want to do it and what the reactions are and what the outcomes are. And usually what happens is that somewhere in that story, like you can definitely see that it's not working. And I try to point that out. Like, so it sounds like you're telling me that this didn't work for you. And how did you feel about that? And so I try to be very gentle and unassuming about it, and try to help them to see the link that it's really not working. But practically speaking, a lot of times if it's something that's really concerning and I have to make a report about it, then it's something that someone else is also regulating too.
And I could imagine that, a lot of times it's probably not a parent who's thinking through their actions. It's probably just somebody, getting stressed out, lashing out, reacting.
Right.
And that's very dangerous compared to,
Right.
Yeah.
So, and that's another example, after I get to know families, I sometimes will turn to the parent or caregiver and say, this must be very stressful. What are you doing to care for yourself? And I think that takes some time, right? It's not something I would say on the first visit.
Yeah.
And the important thing is to establish that relationship and establish that trust.
So in a way, you're doing kind of as a child adolescent psychiatrist, you're doing two jobs. One's with the child and the other's with the parents. Are you getting paid twice as much? You should be.
No.
Okay, so we have a question. Me too. We have a question about culture and religion. So they're asking, how can we keep open communication with our kids about our Arab culture and religion and still not make them feel different than their peers, especially at school?
Yeah, that's a really good question. I think what I found in working with kids is that you have to meet them where they're at, and forcing things doesn't really work in the long run. Certainly when we were growing up, culture and religion was very important, and we would go to, Sunday Islamic school, and we would talk about aspects of culture and religion. And that's definitely a personal decision that every family makes. But I have found that compelling people to religion or culture and setting, I don't know what the word is, but excessive rules and limits around that can sometimes backfire. And I've seen children challenge that. And, I think that some of it needs to just be sort of an ongoing discussion of, this is what I expect of you. These are the rules of the house. These are the cultural and religious norms that I expect from you, like the minimum, and then you have to decide for yourself what's important to you as a parent, and then what you can let go.
Yeah. And a little background on me is I come from, my parents are immigrants, right? As many of us in this nation are, or a nation of immigrants.
Right.
And it took me to adulthood to kind of feel this, or to understand this, but hey, it's okay to be different, right? A lot of times my parents, or immigrant children, their parents want them to always kind of fit in and become the same, or, the norm, quote unquote. Yeah. But a lot of times the norm is, accepting that, hey, we have a little bit of, there's differences, and that's what makes us special. That's what makes us a special place, is our diversity, right?
Right.
So, and that brings up a good point, because like children, they might not understand it. They might look at themselves and be like, why am I different? Right. And that's what goes around, why aren't I like this or like that? What can we do to kind of build that resilience or build that confidence in our children?
Well, and I think it comes from modeling, right? So we have to create communities. We have to create larger communities, whether that's schools, whether that's recreational clubs, whether that's the media. We have to create communities where diversity is celebrated and diversity is honored, and being different is okay. I mean, I'll give you an example. I remember being on the elevator one day in the hospital, and someone came up to me and saw my badge and said that, saw that it said psychiatry. And this person said, "Oh, you're who I need to talk to." And I was a little confused. And this was a hijabi woman who was much younger than me.
Hijab means headscarf, right?
Right. So she was wearing a headscarf. She was Muslim. She was younger, college age, and she said, "Oh, I'm interested in going into becoming a psychiatrist." And I didn't realize that like hijabi women can be psychiatrists, right? So, that to me, representation matters, and that means that we have to show that we honor the diversity. Until we do that, it's hard to expect that kids are going to honor it themselves too, and to realize it's okay.
And so, that's actually a really nice story. I think it shows that, hey, sometimes we just need to see that somebody like us, or somebody who might, have the same skin color, or from the same country, or follow the same religion or something, are doing these things that we actually have the capabilities to do. And then, and so like modeling, like you said, it kind of models after, and that's like the communities, like that's how they flourish. That's beautiful.
I think about myself, and I look at people like, Ilhan Omar, and I think, wow, like that's amazing.
I can be a congressman or congresswoman. Yeah.
Right. So, it's so great to see people being valued for their diversity and being honored and cherished for that, and that being celebrated.
Yeah. And so too, before we wrap up really quickly, some words. I know COVID-19 is still around. Children's mental health, it's a pressing issue. It always is. There's increasing awareness before the pandemic. During the pandemic, there should be increased awareness about it. How about following the pandemic? What sort of fallout do you kind of see happening around you, whether it's the inpatient psychiatry units, the outpatient clinics, whatever it is? What's the kind of trend you're seeing right now, and what do you kind of foresee happening after the pandemic is over and the fallout of that?
Yeah. I don't know that I can necessarily generalize things, but what I think we're seeing some of is, and again, I'm speaking from a very skewed perspective, very specific perspective from inpatient, but what we're seeing initially, at some point there was a lapse, right? Some mental health services may have stopped or may have changed because everything changed to virtual. And in some ways that's very convenient. In other ways, it's not as convenient. And so you're seeing the effects of that, right? Maybe a break in regular mental health services. So people aren't getting the treatment that they need. People don't have access to the support services that they need. We're starting to see, now that people are returning to school, some of the stressors that were there before are just being heightened, catching up. You know, the lack of socialization, all of that is definitely leading to feelings of isolation and loneliness and sometimes despair. After all of this is over, you know, I don't know. I think in some ways we might be worried about socializing, right? We might be concerned about, oh my gosh. I mean, I know that when I accidentally leave the house without a mask, even if I'm just going for a walk, I start to think, oh my God, what am I doing? I can't imagine right now, right? I can't imagine right now what that will look like, you know, a year from now or 2 years from now, whenever a vaccine comes out and it's safe to go about our usual activities, whatever that might be. I think.
Well, I'll tell you, you know, we're glad you're out there on the front lines, kind of fighting this.
Thank you. Thank you so much. And honestly, it's you know, it's the work that you're doing that really is important, and bringing services and opportunities to so many people in need. And I just, you know, I want people to know that there's help out there if they need it. And it's okay to not be okay.
Yeah, it's okay to not be okay. I like that. So that's a beautiful ending to this, but there is one more thing I got to ask you. If it's possible, let's do this little exercise here. Can you break the stigma? If you have 1 minute to break the stigma about getting your children mental health help, what could you say in that 1 minute?
Well, I would say that if your child, suppose I told you that your child had an illness that could cause them serious physical harm and could potentially affect the quality and length of their life. Most people would probably say that absolutely they would go out tomorrow and get treatment.
Yeah.
And that's what mental illness is.
Okay. So see it just as a physical illness, like, hey, like you got to get it out, like you're making your children almost in a way suffer more by not addressing it for. Is that fair to say?
Yeah, and
it's
definitely not intentional. It's definitely not intentional, but by, you know, if everyone deserves help at some point, and for some people that help happens earlier, that need for help happens earlier in life than later. And there's, like I said, there's nothing wrong with seeking help. It's very much like anything, like, you know, asthma or diabetes or cancer. Getting treatment is out there, and people deserve to live their best lives. And you deserve, as a caregiver, as a parent, you deserve to have a child who's happy and healthy and doing well.
You know, that's really, you know, I think everybody wants that for their children, you know. And, you know, we definitely have to have you back. I think there's a lot, we could talk about this for hours.
Absolutely. I'm happy to come back anytime.
Okay, awesome. We'll set that up. You know, Dr. Erum Ahmad, I want to thank you so much for joining us and you know, being a part of this and trying to help out the community. Awesome.
Thank you.
Thank you for being here, you know, supporting us. And again, this recording will be up on our Facebook at facebook.com/Salaam Cleveland. It'll be up on our YouTube at youtube.com/Salaam Cleveland. It will also be up on different podcast platforms at a future date. Again, this is Salaam Clinic Live #2. I thank you, Dr. Erum Ahmad, for joining us. And we'll be back. And remember, you can always catch us live. It will come on Thursday at 7 to 8 p.m. And the date you can find out on our Facebook. All right. Thank you, everybody. Appreciate it.
Thank you.
Take care. Bye. Thank you, doctor. Awesome. You want to say bye?